Hey everyone, welcome back to our series on answering your questions here at Citizens Bariatric Center. Let's get to our question today. Weight regain after surgery. This comes up a lot. Many times patients will come in here and they'll say, well, I was interested in weight loss surgery, but I know of someone who had a negative experience and has had some weight gain following surgery. I look at it like this. Obesity is a disease. It's a chronic disease. I think of it like I would heart disease or cancer. And we know there's going to be situations where treatment needs to be ongoing and treatment may need to be adjusted. There's going to be some relapse. And with obesity, oftentimes that relapse involves some sort of behavioral component. So it seems somewhat unfair as it tends to point the finger at the patient. And oftentimes we know that there's multiple factors involved. So let's talk about reasons why one might experience some regain after surgery. The most common reason by far that we tend to see regain, assuming that an effective weight loss tool has been provided like surgery, is a progression into a processed diet, particularly processed liquids. Now, when we think of processed calorie liquids, we think of sodas and sweet tea as the most common examples. So these liquids can run right through any stomach, no matter how small, and oftentimes will allow for potentially rapid and excessive weight regain. So we have to be very careful about liquid intake after weight loss surgery. Another reason would be just processed food calories. You talk about the snacking foods or the foods very high in processed carbohydrates. We don't have to have large meals or excessive amounts of these to see some element of weight regain. Now, that being said, I have never met a patient that had weight loss surgery, that had significant weight loss, that wanted to have regain down the road. This is a very difficult, often very sensitive area for patients. So anytime we see that behavior creating some scenario where some regain has occurred, we want to address this sooner versus later. And in the mindset of the patient, oftentimes it's to do just the opposite. It's, well, I'm going to get this weight back off before I go back to my doctor. And that's the disease talking. That's that underlying element that's triggering some shame, some behavior that tries to promote avoidance. And we really want to address this as soon as we can. Certainly, we know this is a chronic disease, and we know there's times that we're going to need to do things. And in fact, we can actually combine modalities. We can look at where we need to work on some behavioral component. We may have to employ some sort of counseling. As we know, food oftentimes is just a symptom of some underlying problem. So we may employ that in addition to using things like medications, and there are certainly surgical revisions that may need to be used years down the road. So we have those tools available just as if we were treating some other condition like heart disease or cancer. So we don't want to look at it as an all or none. We want to look at it as that what can we do to keep the best result, and if the result starts to slip, the sooner we can address this problem, the more we can do to turn it around. Now back to the original question, what typically causes this? There is by far the number one reason is going to relate to those processed calories. And the further someone is out from weight loss surgery, they may see that there is some loss of the effectiveness of the tool. And that means that without a very good diet and good dietary habits to maintain that the tool may not be as effective as it was in the early years. So combining modalities, getting back on with the right eating behavior, looking at additional medications or possible surgical revision and that's how we're going to address weight regain after surgery. And I hope that answers the question. Don't forget, send your questions to Citizens Bariatric Center. Contact us on the website, or you can go through the Facebook page and contact us through Messenger.